This will be getting another patient list video because the rest of my family is busy. It is the last video that I'm doing is feeding a resident who is paralyzed or bedridden or who cannot feed themselves. Depending on where you're feeding your resident at or your patient at, it could be their room or a dining room, dining hall. So in this case, it's going to be my son's room. So yeah, he's seen it a couple times. Bear with it. You can tell he likes monster truck. So to begin with, you're going to use gel outside. Make sure your hands are sanitized. Always sanitize your hands no matter what. You get your residence tray unless it's already delivered. Sometimes they get delivered and they're just from wherever they're doing our clinical at. Sometimes they're delivered for the resident before the person comes in to feed them. So check on that. Make sure they either get their tray and bring it to them or they already have their tray. You knock on the resident's door, come in, you hand them their tray, or put it on their bedside table, make sure it's ready for them, or on the table wherever you're feeding at. You get yourself a chair, because some residents take a very long time to eat. We'll sit down. You will make sure you know your residence fine. You're going to provide privacy for obviously before you sit down. But provide privacy for them if they want it. Some people do not like the curtain closed when they're eating. Some people do. I have had both types of patients over there in the right bedroom. You're going to check, make sure you know if you brought the tray in before you bring it in. Check the milk, the sheet on it. Make sure it is correct on what the food is and what the food should be. If it's already brought in, make sure it is correct on the thing, on the slip to the food. Check the right residence band, if they have one. If not, check the records. We have our clinical stuff. We cannot check records so you're actually working. Check the records, however it is that your facility or place you're working at does it. Once you are set down and your resident is ready and you have everything you need, that would be to make sure they have the utensils, any extra utensils, because some people do not like their food being cross-contaminated with other spoons or forks or whatever, or extra straws for drinks or what, any extra supplies you need. So get them before you sit down, make sure you have them. You sit down, talk to the resident, if they are able to talk, tell them what they have on their tray, and then you will start feeding. You will feed them, depending on how you are. If you are right-handed, you really want to be on the other side. Left-handed on this side, or you can use either hand perfectly fine. It doesn't matter. I can use both hands independently, easily. So my side does not matter. That's why I'm on this side. So I don't have to look for a chair on that side. And always watch your patient. You're eating them. After you're feeding them, you give them a bite. You watch them. Make sure they chew. Make sure they swallow. Ask them if they're ready for another bite. If they need a drink, you continue to do so. Feeding the resident each time. Making sure you know they're in the right position to eat, which is going to be inclined depending on their condition. Some people cannot actually be inclined when they're eating, so they have to either be setting up or other things because certain injuries do require different positions. You feed your resident to make sure when they're done, that they are full, they're set, they're not hungry anymore, not thirsty. That a little bit longer with a little bit extra time if you are able to make sure that you know they are actually full. Sometimes you might get a little full, and you want a little more. Once you're done, you will get yourself up, move your chair out of the way. Make sure they're okay. Take the meal tray if you have the curtain closed. Ask them if they want their curtain open or not. They do. Just open the curtain. No tray. Make sure they have the tray is in the right position. Make sure they have the crawl light, their bed controls. Make sure they're in the right position they need to be in. Got the milk tray. Take it back out there. Put it in the rack. Maybe come back, if your hands have, go outside, make sure you can't mix right. Sanitize your hands and carry milk right. At least I can. Maybe I'm not tolerant. Come back, sanitize your hands as soon as you come back, and as soon as you can. Sanitize them unless there's something on them. Wash them. Usually it's better to wash them, but come back in, make sure the residence is okay, make sure you know everything's fine, ask them if there's anything else they need, make sure if the chair you brought in, make sure you move the chair out so that it's not in the way. And once they are set, ask them if they want the curtain open or closed or however they want to set it up. You know, make sure you call me if you need anything, walk out, sanitize your hands again. Every time you come in or out of the room, sanitize your hands. That was drilled into us. Don't forget it. And that would be how you feed a resident. Like I said, I'm sorry I do not have a resident to feed because in fact I don't have a resident at all. And my family is actually really busy because I have a 4-year-old and he's overly active right now. Thank you very much.